Donald Trump says he wants to make healthcare great again. But what would he actually do? Trump's healthcare plan carries a $500 billion price tag, while also dramatically reducing benefits and coverage. So, you pay more for less. That's a remarkably bad deal.
We're going to take care of people.
Trump's plan starts with the one thing you might expect from a Republican candidate. Want to guess his views on Obamacare?
Obamacare is a total and complete disaster. It's going to be gone.
Obamacare is going to be repealed and replaced.
Repealing Obamacare would be catastrophic for many Americans. Overnight, millions of people, about 20 million to be exact, might lose their coverage that they gained through the ACA. With no coverage, you probably can't see a doctor. And with no doctor, the only place left for those 20 million folks with no coverage is a hospital. So expect lines around the block at the ER. We're looking at a public health nightmare. The crazy part is that gutting the ACA is just like burning cash. Sure, repealing the ACA would save money, but after subtracting all the lost tax revenue, Trumpcare would be about $420 billion in the red.
We are going to replace Obamacare with something so much better.
So how will Donald Trump actually help the people who lose their insurance and make back the $500 billion he's wasting? He has a flimsy three-point plan that'll insure far fewer people and offer them worse coverage. Trump proposes to instill block grants on Medicaid, which basically would decrease the amount of benefits that states would pay for you. So say you're a heart patient who needs an expensive drug. Now, Medicaid pays for about 100%, or something close. But under a block grant, there's no such guarantee. Too bad.
There is going to be competition.
The next part of Trumpcare sounds like a neat free market solution, allowing the purchase of health insurance plans across state lines. If you live in New York, but there's a cheap health plan in Utah, he says you should be able to buy it. But some states like Georgia and Maine already allow people to buy insurance out of state, and they haven't seen any savings. That's because states make their own rules, and no insurers have taken them up on it yet. More competition sounds nice, but at this point it's just kind of policy mumbo jumbo. Still looking for that silver lining? Trump's plan allows for the government to negotiate directly with drug manufacturers. So if you manage to hang on through the massive coverage losses and hospital and clinic closings, you might have cheaper drugs. Yay. Trump has been ad-libbing his whole campaign, but healthcare needs to be taken seriously. America's getting older, more people are entering Medicare, there's more and more poor people as inequality increases. And whether people have health insurance or the right benefits or not is the reason why many people die in this country.